So I'm disappointed that we're here today to mark up legislation that would repeal protections for our nation's most vulnerable who rely on Medicaid and CHIP for their health coverage. It seems that every week the majority is proposing legislation that seeks to undermine the social fabric of our nation. First, it was repealing the Affordable Health Care Act. Then it was tinkering with Medicare and our seniors' health in the budget. Now we're considering legislation that would yank health care away from children, seniors, and mothers of dependent children. When are these attacks really going to stop? Preliminary reports from CBO show that if H.R. 1683 is enacted, up to 300,000 additional people will be left without health insurance each year. So my amendment would preserve the eligibility standards for mothers of dependent children. My amendment protects women who have children under the age of 19 from the harms of this bill, exempting them from the repeal of the maintenance of effort for Medicaid and CHIP in the Recovery Act and the Affordable Care Act. It makes me sick to know that if this legislation passes as is, mothers could be dropped from Medicaid, even those at 40% of poverty or less, which is, by the way, where half the states are now. I just cannot support a bill that would support dropping mothers of dependent children from Medicaid. Currently, the only mothers who have guaranteed eligibility under Medicaid are those in the 60-day period after labor and delivery and who are 133% of the poverty line. But we all know that motherhood does not end with delivery or 60 days thereafter. And I think we can all agree that right now, just because you might fall above 133% of the poverty line doesn't mean that you have access to comprehensive, affordable health care. My amendment would help support the long-term health of not only of women, but also of their dependent children. Data shows that the children have better health outcomes if their mothers are in the same health plan that they are in. I would also argue that a mother who is healthier is critical to the overall health and success of her children and families. Healthy mothers are able to focus more attention on their children's health because they are not struggling with their own. In addition, allowing women access to affordable health care can set an example for children to be diligent about their health, which we all agree is an important lesson. The impact that mothers have on all of our lives is both physical and mental. We all know that a mother's impact is irreplaceable, and we must do all we can to ensure that our children do not bear the burden of caring for an ill mother because she cannot access insurance as a result of this legislation. Nor should we force financial burdens and stress on mothers because they cannot afford access affordable care. I must admit that lately I have questioned the majority's commitment to women's health. Just last week, we voted to eliminate all insurance coverage for women in need of health services and abortion services. Now we're marking up legislation that could result in eliminating insurance for low-income women who have children. This is just wrong. And I would like to remind my colleagues that this past weekend we celebrated Mother's Day. For me, it's a day to reflect on the memory of my mother. I know that I would not be where I am today without her love and care. I believe it's hypocritical for us to honor mothers on Sunday and take away their health insurance on Thursday. So I urge my colleagues to support this important amendment, and I yield the balance of my time.